Well, good afternoon, everyone. Welcome to the 29th meeting of the Board of Health for this term of council. If you are not here and want to follow along, how would you know? But anyway, if you're not here and you want to follow along, you can, and a lot of folks don't know this. They think that we should be on Rogers, but you actually can follow on a tablet. And it's www.toronto.ca/council, and you can watch our pretty selves in our deliberations. The Board of Health acknowledges the land we are meeting on is the traditional territory of many nations, including the Mississauga of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee and Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 of the Mississauga of the Credit. Are there any declarations of interest pursuant to the Municipal Conflict of Interest Act? Seeing none. Confirming the minutes, July 16th, 2018. Moved by Councillor Layton. Any debate or discussion? Seeing none. All in favor? Opposed, if any? That is carried. Before we get going on the agenda, we have a special presentation to make. Dr. Davila.
Thank you, Mr. Chair, and good afternoon, everybody. I would like to take this opportunity to update the board on an upcoming change to our senior management team at Toronto Public Health. Carol Timmings, our Director of Child Health and Development, and our Chief Nursing Officer, has just announced that she will be retiring, and her last day with us in the office will be January the 2nd, 2019. As such, this will be Carol's last Board of Health meeting, and with the board's indulgence, I would like to take a few minutes to thank Carol for her significant contributions to public health over her many years of public service. Carol has dedicated most of her career to public health and has had a major influence on the direction of public health locally, provincially, and nationally. Carol has been a member of Toronto Public Health's senior leadership team since the time of amalgamation, all those years ago, helping to shape the organization that we are today. Remarkably, she has worked in almost every area of public health. And I think she's one of the few people about whom we can say this in the realm of public health practice. And she has made many important contributions to the organization and to the field of public health. But I'm just going to take a few minutes just to highlight a few that I feel are of major significance for the City of Toronto. First, Carol led the planning and implementation of the Smoke-Free Ontario tobacco strategy, a major accomplishment in tobacco control, and on a subject, no less, that really engaged the community, for those of you who remember and were part of that, and inspired what I would characterize as vigorous dialogue and debate. She also oversaw the student nutrition program expansion from the time of amalgamation until very recently, ensuring that children in Toronto receive nutritious meals and snacks while they're at school. Carol has also held the Chief Nursing Officer position at Toronto Public Health since 2010, leading quality nursing practice, recruitment, and retention for over 800 registered nurses within our organization, as well as maintaining academic partnerships related to undergraduate and graduate nursing education. Over her career, Carol has had extensive executive involvement with professional associations and advisory boards provincially and nationally. She recently completed her term, as many of you may know, as president of the Registered Nurses Association of Ontario, the professional association representing over 43,000 nurses in Ontario, and she is a member of the advisory board for the National Collaborating Centre for the Determinants of Health. There's just a long list here, so please, just a few minutes, I promise. Carol is also past president of the Ontario Public Health Association and the group now known as the Association of Public Health Nursing Leaders of Ontario. Just an amazing list of accomplishments. And in recognition of her leadership and her contributions to public health, Carol has received the Association of Local Public Health Agencies Distinguished Service Award in 2010 and a lifetime membership award from the Ontario Public Health Association in 2015. Carol, your retirement from public health is a great loss to our organization. But I take some solace in the tremendous legacy that you've left for Toronto Public Health, as well as for our public health colleagues here in the city, throughout the province, and frankly, throughout the country. I know that you are retiring from Toronto Public Health, but I am certain that you will contribute to public health and the nursing profession for many years to come. On a more personal note, I just want to acknowledge Carol for the inspiration that she has been to women leaders in public health and in the public sector more broadly. I can remember my first rotation here at Toronto Public Health as a resident some 20 years ago now. And while I didn't get to work directly with you, Carol, your leadership and your professionalism were evident and emanated from across the room or the table, even though I wasn't directly working with you. And it left a strong impression on me and gave me the hope and inspiration that someday, when I grew up to become a public health professional, that I might one day be a little bit more like Carol Timmings. So on behalf of everyone at Toronto Public Health, I want to wish you, Carol, all the very, very best as you embark on the next chapter, and thank you for all that you've contributed to Toronto Public Health and to the health of the residents of our great city. Thank you.
Couldn't say a quick word, but first of all, thank you for that. Oh, well, Joe, am I jumping the chair, the queue? I'll misbehave in my last meeting, but I just want to say thank you so much, Eileen, for that very humbling, oh wow, and most moving overview of my career. I can say, though, that the privilege of being a member of the Toronto Public Service and in particularly to spend, you're right, the bulk of my career in Toronto Public Health will absolutely remain a highlight for me. There's no greater privilege than to be able to serve and do what we can with the power and privilege that we do have as bureaucrats and in the Toronto Public Service. And I do hope in some small way that I have made a difference to the community that we serve here in Toronto and beyond. And I just want you to know that I will be cheering you on and watching the continued work of the Toronto Board of Health, Toronto Public Health, and of course the overall City of Toronto with tremendous pride and gratitude. So thank you very much. Thank you.
Thank you, Mr. Chair.
Thank you, Dr. DeVilla. Carol, I can't remember a time without you being as part of public health. So I know you will be very much missed. So on to our agenda. We have 8 items, and we'll add a 9th perhaps. I'll go through it, and if you want to hold it, feel free to add your name. Health by Design, Active Apartment Neighborhoods Project Update. Anyone to hold? I'll move by Paul Nagpal. Is that okay? The recommendations there. All in favor, opposed if any, that's carried. Heat Relief Services, we have a speaker on that, so we'll hold for a deputation. Number 3, Ontario Public Health Standards Risk Management Reporting. It's a receipt for information. Moved by Vice Chair Sarah Doucette. All in favor, opposed if any, that's carried. Number 4 is the operating budget request. We have both a confidential and we have a presentation on that item, so it will be held. Number 5 is the capital budget plan and request. Oh, the presentation covers that as well? Okay, so we'll hold for that. The student nutrition program update, we can hold that. I'm going to hold it because I have just a little amendment that I'd like to put in as to when the document can be released. And we have to go into private anyway. Number 7 is the Toronto Public Health operating budget variance for the 9 months ending September 30th. Anybody for that? Moved by Peter Wong. All in favor? Opposed, if any? That's carried. And that's it for 1 to 8. Oh, yes, number 8 is Toronto Public Health capital budget variance for 9 months ending September 30th, 2018. Moved by Stacey Berry. All in favor? Opposed, if any? That's carried. And we do have a request to add an additional item from Councillor Cressy, who expresses his regret for not being here today. And the theme is consumption and treatment service guidelines and locations in the City of Toronto. If you've had a quick read of it, it is worthy of being put on the agenda. So moved by Councillor Doucette. All in favor to put it on the agenda, and we'll save it for the end, hold it for now to allow people to review it. Okay, so that's that. So we can start at the beginning once again. We've done about half the agenda. And we do have deputations. So let's hear from, on the theme of 29.2, Heat Relief Services, Gordy Dent, Federation of Metro Tenants Association. We can hear that deputation now. Welcome, Gordy.
Thank you, folks. I appreciate being here today. I'm mostly speaking to heat relief, but I did want to say 2 things before I begin. First of all, I don't know Carol Timmings. I've never met her. But I did want to say that as a tenant advocate, I'm constantly contacted by folks from around the province in different municipalities, and folks from outside of the province, who always want to ask me about the great things Toronto's doing in terms of the public health file. Things around bed bugs, things around molds, lead, extreme heat, smoking. And I believe that they do that because Toronto Public Health actually takes a lead role in a lot of these matters. So again, I've never met Carol, but I can tell you that Toronto Public Health is often seen as a forefront and leader in a lot of these initiatives. So congratulations on your great work. I know that even though we've never met, as a tenant advocate, your work's really rubbed off on a lot of the things that we've done. In that same vein, this is going to be the last meeting for some of you on City Council, including the chair of this committee. And I just wanted to say, as a tenant advocate, a lot of you around this room, Councillor Doucette, Councillor Mackovic, Councillor Shan, who's not here, and a lot of you that are remaining, your work has been invaluable to tenants. I hear about it every day. Some folks I never get contacted on behalf of their constituents, and some contact me all the time. And it's always refreshing when those folks are there, because I know that they're doing their best to help their tenants. So really sad to see you go. On the matter at hand, heat relief services, I did want to make 3 points related to the report. Just to give you a tenant perspective on this, the Federation of Metro Tenants runs a tenant hotline, and as such, the hotline gets about 12,000 calls from tenants every year. And we get to see over, a decade or many decades kind of trends pop up. The first trend that we see around heat relief services is, in our opinion, there's a very small number of units in the City of Toronto that are dangerous. These are units that are right above boiler rooms or furnaces, really poorly ventilated, units that may have been kind of cobbled together in interesting zoning variants. These are the units that we really ask this committee to look at very carefully. One of the reasons why we've in the past pushed for a maximum temperature bylaw is because we want to see these units not be what they are right now, which is possible death traps. You've got, some units that are at 50 degrees Celsius, 40 degrees Celsius. It's way too high. We talk to the tenants in these units, and they're, stripping down during the winter because it's just so hot. And we're worried that one day one of them's going to be maybe vulnerable in terms of health and are not going to be able to handle it. The second big issue that we see in terms of heat is illegal air conditioning charges. This happened, there's a great case of this in Windsor where you had actually some tenants that were low-income tenants, senior tenants. They wanted to put in their air conditioner, but were told they'd have to pay a new fee all of a sudden. They couldn't afford it, they didn't, and they ended up passing away due to heat stroke or heat-related illness. So that is a piece we need to look at. However, the third point that I wanted to make today is we do support the kind of actions that are being put forward in this heat relief service plan. A lot of them involve kind of general cooling centers, and we think this is it's really great that the city's getting on top of this for a couple reasons. There was a famous heat wave in France in 2000, 2001 that killed 10,000 people. We're always afraid that something like that's going to happen in Toronto, so I think it's great to see that the city's actively planning around creating cooling centers, ensuring that there's policies around them, so when that horrible heat wave does come, we're prepared. Another element of the plan that we really like is involving tenants and neighbors. You know, we're the Federation of Tenants Associations. So oftentimes we're working with other tenants associations to educate and help members. We think it's great that there's kind of a built-in component into this plan to try to do that, get neighbors to check in with each other and care for each other and educate each other so that if someone is feeling ill, they can be brought down to a couch in the lobby or helped to get to a cooling station. Again, we thankful that the committee is looking at this. Again, it's a major issue for us. It's coming up every year. We had a huge spike in heat-related calls this summer because it got hot. So again, we thank the committee for doing this. And we hope we can continue to provide input to make sure you have a strong policy to protect tenants. Thank you.
Thank you. Questions? I do have some. I believe at the Tenants Committee, we actually moved a motion to require landlords to provide cooling in their buildings. And are you folks, do you have any policy around that?
We think it's good. Our policy is that, yeah, that there needs to be areas where tenants can go to cool down if, for example, they're in one of those units that's just not very well constructed. Our big concern is that a lot of this relates to actually municipal licensing and standards, kind of new regulatory bylaw. And the issue is that there are certain requirements around cooling centers there, but we're always afraid, you know, are people actually following these regulations? So there's always a concern that, you know, we do encounter buildings where there's supposed to be a notification board with this information there, and tenants are telling us it's not there. That's not really a public health thing. It's more on the municipal licensing and standards side, but the two are related, right? So, you know, the other thing, and I did mention this when I did give a bit of comment on this report, you know, it's great to have a cooling center, but if you're a senior that comes down on the elevator in your walker, and great, you're in a cooling space and there's nowhere to sit down, there's no place to relax, it's not going to be a very good cooling center, right? You do need to have some amenities there. And they need to be accessible. There's a famous building on Kingston Road that has this gorgeous little seating area, and the landlord's locked it. So like the tenants can see it through a grate, but none of them can use it. So things like that, again, have to be worked out.
But do you think that we should be, we the city, not public health, but we the city, maybe through the MLS process, mandating that every tenant has the right to a certain maximum temperature in their unit?
We believe so, yes. And we've advocated that for years now. And I think that there are other reasons why a number of committees have actually not ruled in favor of that. And we can debate that. But yeah, again, our big concern is you do have some units that are dangerous. They shouldn't be rented out, or they should only be rented out if they're cool. And again, we're not talking about a lot of units here. We're talking about a handful of units in the city of Toronto. But again, we think that that should be illegal because it's dangerous.
So, and just my last question was going to be on that. So what do you want public health to do to identify those units and to support a specialized program?
I think the federations always believe that there should be a maximum temperature bylaw. I think that the reasons why folks haven't gone in that direction are because they're assuming that, you know, every unit's going to have to be retrofitted, or every unit's going to have an AC unit. That's not our opinion. Our opinion is, you know, 99.9% of the units nothing's going to change. But there are a very small minority of units out there that are dangerous right now and need to be tackled. So under the system we envision, if you're in a unit like that, you'd call MLS. MLS would come in and go, whew, it's hot in here. You've got to get the temperature down in here, and they would leave the landlord to kind of work on that.
And what would you like public health to do?
In a scenario like that, if there was a public health bylaw or a municipal licensing and standards bylaw, they would go in and order the landlord to fix it. We have asked public health to kind of look into that. I don't think they want to, for whatever reason, and that's fine. Outside of that, we do support a lot of the recommendations that are happening here. Mandating cooling centers, mandating where they're happening, and again, kind of a neighborhood program to ensure that people are getting healthy.
Okay, thank you very much. Any other questions? Yeah, comment? Speak? Okay, well, we're not there yet. Any other questions of the deputant? Okay, thank you, Gordy, very much for your comments, helpful comments. Okay, there are no other deputants. We are now on to questions of staff. I do have one or maybe two questions, staff. I thought that this report doesn't address who's paying for the cooling centers. Are we going to? Is the proposal that we continue to pay for them? If I remember right, they were located in the emergency preparedness budget. So has that been resolved?
So actually, it has been resolved for the past couple of years, and it's within the context of the public health budget. It has not been in the emergency preparedness budget.
Okay.
The city's emergency preparedness budget. So it is actually, it has been funded out of public health.
Okay, I didn't see any report on it. Was there a report on that? Because I think the motion from the budget committee was to get a report back on it, on how you resolve it, and I guess you've just kind of resolved it. Now let us know.
So through the chair, as the medical officer of health said, when we were asked to, when it was shifted from emergency service to us, we were asked to evaluate it. So we ran it in order to evaluate it. Going forward, that's why the recommendation is a work group to look at how everyone contributes to this issue, meaning not just the cooling centers, which are really facilities, and it has been public health, but also parks, rec, libraries, MLS, because as you mentioned, they're working on looking at how to resolve the challenge of heating apartments without putting the cost on the residents. So the work group will need to determine where this lives in the long term and how it's funded. But what has been good the last couple of years while we've been doing evaluation, the first summer the heat was just not like last summer, so we needed to look at it over the last couple of years. But the work group has informally been meeting in order to jack up the work that we do across the city, so to make sure there are more cool spaces available, as the deputant appropriately mentioned, for individuals who may not have a cool space in their building because the landlord just has to publish or provide. So if he or she doesn't provide, they just need to publish where the closest cooling space is. So we've been working on increasing the number of cool spaces and the way that they're promoted. The staff who are working them trained to identify and promote. So the issue with the budget has to be resolved with that work group because it really sits not just in public health. Will
we get a report on that? On who's paying for what?
We can report back after this group's gone through another season, if that's your wish.
Okay. The other question is do you need a motion around dangerous units?
Dangerous.
We've all seen them in knocking on doors.
We are participating in the work group, so through you as chair, and it's your call in terms of directing, but we are more than happy to take the input that we've just heard from the deputant to the work group that is led by MLS and is looking at all the feasibility issues and make sure that that's addressed in the report that they'll bring forward at the end of this year. So
do you need a motion to that effect, or can we?
So, Mr. Chair, at this time, I'm not sure that we can speak to that. I know that our colleagues at Municipal Licensing and Standards have been leading the work in respect to the bylaw, and I don't know how knowledgeable they are in respect of identifying those dangerous units. So it's challenging for us to say whether we need one, because I'm not certain as to what level of information they have at MLS in respect of their ability to identify those dangerous units.
Okay, any other questions? Okay, to speak, Councillor Doucette.
Actually, I just want to thank Gordy for all his work. As a councillor, it's been very, very useful to know we have somewhere to turn when a tenant has a question. I used to be in property management, so I thought I'd seen most of it, but I haven't and hadn't. So thank you for you and your team. You have been extremely helpful to our residents, to our tenants. And thank you for coming and doing a deputation, because I wasn't aware of these dangerous situations you've informed us of today, and I think I agree with the chair. It's got to be included in there somewhere through MLS, through health. That is completely unacceptable. Completely unacceptable. I mean, I know I volunteered in schools where the classrooms beside above the furnaces were absolutely terrible. It took me 10 years to get a valve changed. It was a valve, and that was it. But anyway, so thank you for the report. Very important. I mean, we talk about, you know, all the cold. We don't always talk about the heat. So this is as vital. And I hope this working group really does come up with some good, tangible issues that we can deal with. I wish every landlord had to do a cooling room, a heating room, whatever you want, whichever time of year is needed, but I understand we can't make every landlord do that. But as a city with so many buildings owned by us, we should be there to help tenants and residents in times of need. So thank you.
Okay, so this is going to City Council anyway, I understand. And so I do have an amendment to include the dangerous units piece that I'll read out, and basically is request the DCM and Medical Officer of Health to include in the work plan a strategy to deal with units that are dangerous from a heat perspective. So, and then we can move the motions that are before us. Any further comments? Can we do it as a package? All in favor, opposed, if any, that's carried. Thank you. Next is, are we ready to go to the budget? Okay, let's go to the budget. Dr. Davila, presentation time.
We do have a presentation. We have some colleagues. Sorry. Thank you, Mr. Chair. We do have a presentation. I have my colleague, the Director of Finance and Administration, Althea Hutchinson, joining us at the table up there. She'll help drive the slides. Ready to go? Okay. So thank you. We do have our presentation in respect of the reports regarding our requested 2019 operating budget and the 2019 to 2028 requested capital budget and plan. This presentation does cover, as you'll see on this overview slide, 3 topics. However, I will be focusing most of the comments in respect of this presentation on the agency overview and therefore what it means to the 2019 operating budget. So moving on. At a high level, Toronto Public Health's mission can be summarized in 4 parts. The first, we strive to improve the health status of our citizens by focusing on the whole population and by taking a prevention-first approach. We also recognize that there are health inequities, and we structure programs and services and put forward policies aimed at reducing these inequities. We strive to be in a state of readiness so that we're able to respond effectively to emerging health issues and threats. And finally, we recognize that we're part of a larger health system and think that our contribution to that health system, and in particular our contribution to our health care system, is predicated on our success in the other 3 areas: improving the health status of the population, reducing health inequities, and preparing for and responding to emerging public health threats. This audience probably doesn't need much education on the fact that public health has a long history of advocating for changes that have had significant impact on the health of our citizens and the population writ large. Simply put, when done right, public health actions prevent bad, negative things from happening, which in turn yield positive health outcomes. Case in point, from 1970 to 2010, the average life expectancy has increased both for men and women. In the case of men, over that period of time, life expectancy increased by 14.4 years, and women's life expectancy increased in that same period of time by 13.5 years. And while this increase in life expectancy cannot be solely attributed to public health actions, we do know that our policy initiatives, our communication campaigns, and our specific public health activities and interventions, including clinics, are contributing factors. In fact, it's through the use of levers like policy, communications, and other public health interventions that we actually saw a reduction in measles cases, and a significant reduction in measles cases in Toronto from 1995 to 2017, and as well significant reductions in smoking prevalence from 22.5% to 14.5% in that period of time between 2001 and 2016. We also know that over and above these particular health benefits, our public health actions have also had a positive financial benefit in providing savings to the healthcare system, as noted on the slide that's before you right now. Toronto Public Health success, we've talked a little bit about its success and the contributions by individual members of our senior management team very briefly this afternoon. But we know that our success is not just rooted in the past, but in fact, it is still ongoing, very much current, and forward into the future. We continue to address the public health needs of our diverse communities through such activities as screening our children for various adverse birth and developmental outcomes, through the provision of student nutrition programs and the provision of immunizations. These are interventions all aimed at starting people off to a good start with health and maintaining their health. We also know that public health is best supported through collaborations and integrated approaches, which is why we partner with other city divisions and with community partners to champion public health, healthy public policy. For example, we work with our colleagues at the shelter, in shelter and housing supports and administration on extreme and hot weather responses. We work with community agencies to distribute naloxone in response to the opioid overdose crisis. And these are just two of the examples that I can provide you in respect of our collaborative and partnership opportunities. Toronto Public Health also has a long-standing history for innovation, and in keeping with that tradition, we're looking at how technology can better support us in terms of achieving our mission of a healthy city for all. To that end, we've partnered with our colleagues at SSHA and at the Chief Information Office, or with the Chief Information Officer, to investigate how artificial intelligence can be used for predictive analytics to better support the residents of our city who are experiencing homelessness and underhousing. So turning now more specifically to the 2019 operating budget, we will meet the city's 2019 budget target guideline with two efficiencies that have already been approved by the Board of Health Budget Committee, and another option which we're presenting to you today for your consideration. These particular issues contain confidential information, and as such, the details will be discussed during the in-camera session of this meeting. We've also submitted new and enhanced requests totaling $2.5 million gross or $1.3 million net. Another way to look at that is that this represents a 2.07% net increase, and these were also approved by the Board of Health Budget Committee. So assuming that these enhancements are approved through the full budget process, TPH's operating budget will be just under $256.7 million gross, or a little over $65.1 million on the net. Going to the next slide. This slide outlines the major service areas of Toronto Public Health and would be familiar to those of you who've actually had the opportunity to review previous budget documents. These areas mirror the service categories as outlined under the Ontario Public Health Standards. So what are we trying to do at Public Health? As we've talked a little bit about our mission, but when we're looking specifically at what we're doing, we strive not only to meet the current public health needs of our current population, but further, we seek to identify and address the circumstances that will affect public health in the future. Part of our mandate is to root out and investigate trends and emerging factors that influence the health of the population and create health inequities, with the goal of putting into place the right public health policy levers, the right public health communications, and the right public health interventions. Housing is a critical social determinant of health, and I'm sure I don't need to tell those in the room, is a pressing concern here in our city. On average, 22% of renter households are spending more than 50% of their income on shelter, a significantly higher percentage in comparison to the benchmark of 30% provided for by the Canada Mortgage and Housing Corporation. In June of this year, I brought forward a report that outlined a number of initiatives to take advantage of available provincial funding to support the city's efforts in addressing a housing situation that is becoming more urgent and critical. This work will continue in 2019 and beyond with the approval of the new and enhanced service proposals that are being put forward in this budget request. Food is another significant social determinant of health. The statistics for food are worrisome when it comes to how much low-income households are actually spending on food. The city has taken a leadership role in supporting the student nutrition program and has an opportunity to continue to demonstrate strong leadership in continuing to fund this program and to maintain its commitment to fund 20% of the program costs, as well as to extend the program to independent schools that meet the necessary eligibility criteria. And the final area of focus, as articulated on the slide, is a vibrant and inclusive city. Toronto Public Health will continue to support and engage with our city partners in initiatives that support and enhance such things as mobility, transit, the built environment, and social inclusion. One of the key areas for this kind of partnership opportunity is through the Toronto Urban Health Fund and its support of youth agencies to deliver resiliency-building activities for children and youth in our city. Moving now to the next slide, we have here a snapshot of where the money is spent in support of our 6 service areas and where the funding actually comes from for these areas. Just by way of reminder, the city contributes 25 cents for every 75 cents of funding from the province for those cost-shared programs, and that 25 cent accounts for the city's contribution in each of those service areas. In addition to the 25% contribution for cost-shared programs, the city also funds the student nutrition program and the seniors dental program at 100%. Turning now to the next slide, you have a graphical representation of the 2019 new and enhanced budget requests. So just by way of reminder and bringing you back to some of the information that's outlined in the report, $254.1 million is the base budget that's required to continue providing the services, Toronto Public Health Services, at existing 2018 levels in 2019. As shown here on the slide, a request for $2,585.5 thousand gross has been put forward to support building a healthier community. And as articulated at a very high level on the slide, the additional funding will be used for a variety of different issues. So the first area is to address emerging public health issues related to the city's shelter system under the housing and health component, and that's shown on the slide in green. So under this area, the following 5 new and enhanced services have been put forward. First, community outreach for Toronto Public Health harm reduction clients. The second, infection prevention and control supports for shelters and respite centers. Third, the collection of health data in the homeless population. Fourth, a communication strategy initiative. And fifth, program modernization initiatives. And the numbers and figures are articulated there on your slide as well. In respect of the area of food and hunger, the following 2 new and enhanced proposals are being put forward. First, the student nutrition program to maintain the municipal contribution at 20% of total program costs, which represents $0.3 million gross, and also 0.3 million net. And the second is the student nutrition program expansion to independent schools for 0.625 million gross and 0.603 million net. And finally, the area that's depicted in the orange at the top of the slide, services meant to support a vibrant and inclusive city. There is one enhancement that's being put forward. It's an enhancement to the Toronto Urban Health Fund, year 5 of a 5-year program that has been previously agreed to by the Board of Health, totaling $0.150 million gross, $0.038 million net. And in addition to the new and enhanced request outlined in this chart and on this slide, the Board of Health Budget Committee requested additional information on enhancing funding for the Toronto Food Policy Council and Creating Health Plus as part of this budget cycle, for which a separate report has been submitted, and I believe you all have that. And our slides are going away.
This is a sign in the essential unreliability of technology.
I thought you were going to suggest it was a sign of a different nature.
Oh, now it's back.
Well, as it turns out, that actually brings me to the end of the presentation. So perhaps our technology is becoming, I did talk about predictive analytics. Perhaps our technology is advancing in that realm. There are many other points that we can bring. There is actually a much larger slide deck, which I know members of the Board of Health have in front of you. Very happy to take questions on any of the information in the reports, the rest of the slides, but I think we'll leave the presentation at that for now and take our cue from the technology. Thank you, Mr. Chair.
Thank you very much, Dr. Davila. So we have the deputations, we have questions of staff, and we have an in-camera portion. And I'm suggesting that we start with the deputations from members of the public who are here today. So we'll start with, there are 3 deputants, Anita Prasad, Victor Willis, and Jamie Foxx. Welcome. Maybe we'll start with Anita. Welcome, Anita.
Good afternoon. My name is Anita Prasad, and I'm here to speak from the front lines about the impact and value of the Creating Health Plus program. I work as the Food Security and Systems Coordinator at the Parkdale Activity Recreation Center, known to most folks simply as PARC. PARC has been a member of this program since the beginning and has also played a lead role in the advisory committee since the program's inception in 2007. Over the last 3 years, PARC has also trusteed funding from the Ontario Trillium Foundation and overseen the work of the project coordinator, which is a position that I've had the privilege to fill. Creating Health Plus is a partnership between Shelter Support and Housing Administration, Toronto Public Health, PARC, North York Harvest Food Bank, and the Toronto Drop-In Network. This initiative evolved in response to research that identified considerable gaps, nutritional gaps in the meals served at Toronto drop-ins. Drop-in centers are low-barrier, high-impact program spaces that serve some of our city's most vulnerable residents, including those that live on the street. Now, these are folks that face a whole host of complex issues that intersect to impede access to regular nutritious meals. And as a result of that, they experience very high prevalence of chronic illnesses like diabetes, heart disease, and hypertension. And for most of our participants, the meals that are served at our member drop-ins are the only food that they will access for the day. And so this area of high need is where Creating Health Plus focuses its efforts. And on a weekly basis, we provide a large quantity of eggs, milk, yogurt, fresh fruits, and fresh vegetables. The program serves 29 drop-in centers across Toronto. Now, most of these drop-ins are in the downtown area, but more recently, we've been trying to focus some of our growth efforts on neighborhood improvement areas and food deserts. In 2017 alone, we provided about 250,000 pounds of food, and tracked over 11 years, this program has provided 2.75 million pounds of high-quality, nutritious, fresh food to community agencies. And collectively, our 29 member agencies serve approximately 1.5 million meals a year. We are a simple and targeted health intervention. We've made much progress in improving nutrition for our community members. So for example, fruit and vegetable servings almost tripled pre and post the Creating Health Plus intervention, and this was assessed by Toronto Public Health. Daily vitamin D intake also doubled, for example. And our drop-in centers went from serving things like donuts and sugary cereals for breakfast to serving fruits, eggs, and yogurt. I don't think I need to spend too much time convincing anyone here about the power that food has to transform health, but I have provided all of you with reports that try to dig a little bit more detail into the potential health impacts of our 5-item food provision. We've also trained 30 chefs across the city in health, nutrition, and cooking skills. And the goal of this was to improve the health and wellness of community members through the food that was being served at these drop-in centers. So chefs, for example, learned how to cook heart-healthy breakfasts, learned how to prepare low glycemic and low sodium meals, and we're trying to build a strong knowledge base in plant-based cooking as well. We've also built a growing community of practice where our chefs trade recipes and information, they trade food, they mentor and support each other, and they share best practices. For those who are interested in the numbers, this program also offers good value for money. In 2017 and 2018, we tried to look at the social return on investment for this program, and I've provided you with a copy of this as well. And what we found was that for every dollar invested into food, we created 1.94 in value. Similarly, every dollar that was invested into training through Creating Health Plus, $2.15 in value was created. I'm just going to quickly tie up here with some direct testimonials from some of our drop-in staff and community members. When we conducted focus groups, 91% of drop-in participants reported that our weekly provision of these 5 food items makes a positive difference to their lives personally. 70% of the participants report that there was a significant improvement in the atmosphere within the drop-in as a result of the improvement of food. So there were fewer fights, it was a calmer atmosphere, people were more content after they had eaten well, and stress levels for staff as well went down noticeably. One participant said, and I quote, "My overall health has improved and there's more variety in the food being served." Another said, "It feels like someone cares about me when I get a good meal to eat." And staff, when asked, they said, "When given a choice of healthy options, people always bypass the sugary food and reach for things like fruit and dairy." Staff also report that our food provision helped relieve budgetary pressures greatly. I hope that everything I brought you today leaves you with some food for thought, pun intended. Thank you all for your attention. I'm happy to answer any questions you may have.
Any questions, folks? Councillor Doucette. Thank you.
Thank you for coming today. I haven't had a chance, obviously, to read through this. So you serve breakfast, lunch, and dinner, is that right? Or what meals would you provide?
So among our 30 drop-in centers, there's some variation as to which meals are served. So Park serves breakfast and lunch 365 days of the year, and breakfast and lunch tend to be the meals that are most often served. A couple of our drop-ins sometimes serve dinner, but that's not as often.
Right, so sorry, just correct me. So you serve food in Parkdale at Park, and you also provide, sorry, how many different agencies with food?
28 other agencies. And then Park, yeah, so 29 in total.
Right. That's amazing. Thank you very much.
You're welcome.
Thank you, Councillor Doucette. I have a quick question, and it really isn't to this, because you're really speaking to the quality of the food, not the adequacy of our drop-in system. Can you speak perhaps to that as well, just while we have your wisdom here?
I think quality is important. If I was to tell the truth, despite the vast amounts of food that we've provided over time, scarcity continues. Scarcity for good, fresh, healthy food continues to be an issue in the drop-in sector. We've had a number of drop-ins that are still waiting for admittance into the program. So there's a number of drop-ins that don't receive this food at all, and so that's an issue. Also, we've been told that the quantities we provide are not enough, because as more and more people start to use drop-in programs, and our budget hasn't really grown much in 10 years, that impact of that food goes down because there's just more and more people to serve. So part of our work is actually fundraising to try and address that ongoing scarcity to actually meet some of the needs within the drop-in sector.
Has that scarcity been quantified? To your knowledge? It's okay if it's not.
No.
Okay, that's something.
I'd like to double the quantity of food, if we could.
Okay, great. Thank you very much. Paul, questions?
Just to follow on that, how many other drop-in centers are there? How many have applied that you can't provide for right now? And that, from a gut feel, how much more food would be necessary if we were to satisfy the current needs, even within those 29?
So we have 8 more drop-ins that are awaiting admittance into the program. As I mentioned, we were talking about priority neighborhood improvement areas as well that don't really have many drop-ins. So there are other kinds of meal programs outside of drop-in meal programs that could also really benefit from this. But just strictly speaking, drop-ins alone, we have 8 that are on our wait list. When speaking to our member agencies, all of them said that they would like to receive double the quantity of produce and double the quantity of eggs. When it comes to yogurt and milk, it's a little bit different, but those are the 3 items that are very sought after because they significantly impact breakfast programs. There's also been a lot of requests for meat, which is something that we haven't been able to provide. I'm talking about healthy protein. And so part of our fundraising efforts then try to actually bring meat into the drop-ins as well. So the question is about increasing quantity, but also adding new items to the basket to make it a more well-rounded basket.
And where does the current funding come from for the food budget itself?
From Shelter Support and Housing Administration. And then part of my work is about raising more money to add to that. So we've had funders like United Way and other foundations that have contributed to the program. Public Health has offered enormous in-kind support and also offered some funding to do some of this research that we've done. But food budget comes from Shelter Support and Housing.
Great, thank you.
You're welcome.
I had some questions as well.
Thank you for coming today and sharing the information on your exciting program. Just a question around culturally appropriate food. Are you addressing some of those issues, especially in the neighborhood improvement areas?
So far, we've only been able to add 1 agency in a neighborhood improvement area. When we're training chefs, we do talk about culturally appropriate food, and so we've brought in food, and so based on surveys about what kind of food people serve, what kind of clients visit drop-ins, we get a sense of what kind of food people want to learn how to prepare, so what kind of recipes. And so we do a lot of sort of focus groups. We bring that information back, and then we create the training curriculum accordingly. So over the last few years when we've done training, we've done covered food from many parts of the world based on the requests that the agencies put forward. In terms of purchasing culturally appropriate food and providing it to agencies, that's been harder because what we're trying to do is get as much quantity of food out there. So based on seasonality, where it's grown, it's those and nutrient value that we select what items we provide in terms of produce. And that produce changes week to week so that people are getting a wide range of nutrition through the food that we provide. Does that help?
Thank you very much for your presentation. Much appreciated, Anita.
Thank you.
Next, we have Victor Willis, Parkdale Park.
Good afternoon. And actually, I do want to just commend Joe for your work on this committee. And I certainly know, I live in Joe's ward, so we actually meet around food on Saturday mornings at the Witchwood Barns Farmers Market. Food is central, of course, to the health of the city. I also want to commend the medical officer of health for being at Park. I was getting hip replacements, so I wasn't there, but as you can see, they work, so that's the good news. But also for coming down to Park to see what a food program in action can do, as well as the kind of partnerships. So it was great to be able to walk in today and see your budget and see your strategy and to hear about what your plan is, because of course just about everything you talked about, when you boil it down, is really what we're trying to do at Park and of course across this program. So, and I'll give you a copy of my deputation afterwards so that you can have, because there are some questions you asked that I'm hoping that I can answer, which is really about food budgets for programs like drop-ins. And we did a bit of research in 2012 because we asked some key questions. How does food get into a community? And we started with Parkdale, and there are a number of social service agencies in Parkdale, and we asked the question, how does food get into our community? And we started to look at budgets, whether it was public health, at community health agencies, health-funded agencies, social service agencies, churches, etc. And the one common denominator is that most of the food is donated. So when we talk about feeding 1.5 million people, obviously we're very grateful for the budget that shelter support and housing puts into it, but clearly 330,000 people is not going to make $330,000 is not going to feed 1.5 million people for the kind of impact that we're looking at. So much of what we receive is based on donations either from Daily Bread or Second Harvest. Of course, Second Harvest is rescued food. It's a very good program, but the reality is that some of that food, especially the kind of food that we're trying to look at from a nutritional aspect, it's not going to survive the rescue operation. So, you know, salads, the kind of fruit, the things that we know are really important, they're not going to make it from whoever is no longer needing that food onto a truck, driven across the city and dropped off at Park or any other drop-in. So food budgeting and how food gets into community agencies is a key, I think, a public health issue. One of the things that we learned in our research was that most organizations were not able to get food, a food budget, and so therefore they are very creative in their ability to figure it out. Often it was dietitians who were being paid at a fairly good rate to go to No Frills with No Frills cards in order to get the food to run their program. That doesn't really make sense as well. The piece that Anitha brought up and that we're talking about here today is the fabulous partnerships that are helping to leverage the various players who are improving and making it to spanning the gap in food security in our city. Daily Bread, North York Harvest, Second Harvest, the Creating Health Plus program, Shelter Support and Housing, Toronto Public Health, of course, from a research and in-kind point of view, as well as what we're hoping is that you'll consider continuing the coordinator position, which you did once and we were so thankful for. Obviously, you can see the kind of investment it makes. Anitha is fabulous. But the real piece is, in order for us to spread this program, to get into the neighborhood improvement agencies, and to start to get those other 8 drop-ins, as well as other groups, into the areas that we know we're not achieving, that's what this is really about. It's a partnership. No one person is doing all of the heavy lifting. Many are doing it. Park augments our budget, our food budget, so we get donations. We're able to determine, we know for sure we're going to get milk, eggs, yogurt, and fresh fruit and fresh produce. When we know that, we can then start to supplement by purchasing good proteins, meat, fish, and other things. That's how we manage our budgets. Without a coordinator to help us both make the case across the system and to help us also encourage our partners with any research that leverages or builds on the arguments we're making, we're going to be slipping back. I'm very concerned because, of course, I started at Park 20 years ago. We know what happened 20 years ago. A government came into power and it cut 21.6% from social assistance. We immediately saw a huge upsurge in the demand for meal programs. If you haven't read Who's Hungry, the 2018 edition from Daily Bread, look on pages 11 to 13. You'll see the arguments about the people who come to drop-ins. You'll understand that they're paying all of their income, not just over 30%, but all of their income in rent, which means that we're the backstop. We're providing the food so that they can actually survive in a dignified manner. I'll stop there. I'll give you my deputation, and I'm happy to answer any questions you might have.
Thank you very much, Victor, and hats off to you and the good work that you do. Are there questions? I do have one. So, bottom line here, this isn't very big dollars here. The creating Health Plus, basically it's Anita's position. Is that bottom line here?
That's it.
Without naming anyone. And her value add is basically her task is to coordinate, to problem solve, to work across the sector to help agencies, drop-in agencies, 29 of them right now, maybe 8 more at some point in history, to basically figure out how they can add nutritious food to their menu at the drop-ins.
That's exactly it. In my deputation, because I departed the text just to talk to you, the 3 areas that she brings enormous value to are coordination and quality assurance, research, and then capacity building. Under each of those buckets, I've defined a bit of what that does. That's the value of having somebody who's coordinating, and we're not even asking you to pay for all of it. So it's actually coming from a few other pots. Listen, stone soup is how we work. This is how we're working today, and we just want you to add a stone to our soup, and we'd be happy.
Thank you very much. We used to have stone soup suppers at the Witchwood Barns, by the way.
There you go.
Remember that a few years ago. Yeah, okay. Okay, any other questions? Thank you very much once again, Victor.
Thank you.
And next is Jamie Foxx. Welcome, Jamie.
Thank you. Joe, you're just as handsome in person.
Okay, all in favor, Kerry. It worked.
Okay, my name is Jamie Foxx, and I live in Parkdale. Since I moved there many moons ago, I have taken advantage of the drop-in meal program at Park every single day. Without this program, I would go hungry often, and some of my community members eat their only meals of the day there. I was staying in a shelter before finding housing in Parkdale, and my diet suffered a lot because I had to eat fatty and processed food often. It impacted my health in a bad way. In the past, I used to work on Bay Street. I was on the board of directors for my condo. Whenever there was a food drive, I would clear up my cupboards, filling boxes of canned and dried goods, and I thought that I was helping. Now that I'm on the receiving end of charitable food, I see things differently. Canned goods and processed foods are not the answer. Fresh, nutritious food is what we need, what I need. The food at Park is always fresh, tasty, and healthy. This is important to me because I have digestive issues as well as other health concerns that require a specific diet. I suffer from IBS. I have no gallbladder. I was born with one. And until recently, the Hep C virus was attacking my liver. The foods provided by Creating Health Plus, like yogurt, help to soothe my stomach. Eggs are high in protein, but easy to digest. Fruits and vegetables bring much needed fiber and other nutrients to my diet that I otherwise simply would not get. Getting good food simply helps make it easier to deal with all the other challenges that come my way. Further, suffering mental health issues like anxiety and depression also makes it hard to stick to a meal plan or to go grocery shopping. So having a meal prepared by a chef that has my nutrition and health in mind is very helpful. It also gives me pleasure to look forward to eating a fresh hot meal every day. It makes it easier to get through the day and I have more energy. It also helps me to concentrate. As well, it improves my mood when I eat well. The Park drop-in, like many drop-ins, across the city, is a nice, warm, and welcoming place. It is a place where I can meet people and socialize, making me feel less isolated. It's something I look forward to each day. It's a constant in my life. Walking to and from the drop-in also gives me about 40 minutes of exercise daily. And providing funding to meals like this is important to me. It's important because it gets food directly into the bellies of those who need it most. And I would just like to give a big thank you to all the partners who have made this program possible. Thank you.
Thank you very much.
And
We have a question from Councillor Doucette.
okay.
So first of all, thank you for coming out today. Have you ever heard of a store called Feed It Forward?
I've heard of it, yes, but I have not been there.
So Feed It, and I have to sort of ask this in a form of a question. So are you aware, see, I'm still doing these. Are you aware that Feed It Forward on Dundas Street West, just east of Runnymede, is a pay-what-you-can grocery store?
Yes.
And what they do there is anyone can shop there, and if you're buying a bunch of carrots, you can pay whatever you can or whatever you want for the bunch of carrots. So I could pay $20 for the bunch of carrots, which would allow people to then come into the store and take that same bunch of carrots for free. So what I would like you to do, if you could, is spread the word about this amazing store. It's run by Chef Jagger Gordon. And again, this is produce which has come from grocery stores or other locations. So if you don't have the money to buy nutritious fruit and vegetables, you can come in and get your nutritious fruit and vegetables, and then hopefully offset what this amazing program is also doing. So if you could do me the favor of spreading the word. I know it's a little bit out of Parkdale, but it's on Dundas, so it runs through the whole area.
I live on Dundas.
Well, there we go, exactly, nice and easy. I'm not sure if it's further away from you or
Bit of a
where you
hike, but
live.
it's okay.
But if you could do me the favor of spreading this word, because that would help, in some respects, these programs to help more people. So thank you, and that's my sort of question.
Will do.
Could you do her the favor?
Yeah, do me the favor, please, yes or no.
Answer is
Yeah,
yes.
exactly.
Okay, thank you very much.
Thank you.
Okay, that's it. Thank you very much, Jamie, for your good intervention. I think, regrettably, we need to go into camera because there's a couple of in-camera pieces to this budget. So regrettably, I'm going to have to ask folks to clear the room. We'll come back and deal with the motions that can be dealt with in public. Don't go too far. It won't take too long. But the motion is to go into camera to discuss this item, the budget, and also the student nutrition. Yes, how about the student nutrition one? Also considered 29.6, I think it is. If you could add that, that would be great. Okay, all in favor of that? Opposed, if any? That's carried. Yeah, I got a shingle shot. No, pneumonia. number 1 as amended.
So we have these, the motions, and then we have that as adopt as amended at the end.
Okay.
Yeah. So we have, we can display the motions.
Okay, so let's do it your way. Okay, number 2 is to approve the, oh yes, there was also the motion around the creating Health Plus, and you have the report. I think, Paul, do you want to move that one? That's number 2 here. Yes? Is there any debate or discussion on that in a public forum? All in favor, opposed if any, that's carried. It's in, but good luck. This is the first fight. You have about 6 more, right? And you know how that's played. Motion number 3 is to give authority in a public forum for the things that we talked about in camera. All in favor, opposed if any, that's carried. The next one is much the same. All in favor, opposed if any, that's, no. What's the difference between this and that?
This is the confidential attachment 3, and then the other one is confidential attachment 1 to the presentation.
Okay.
No, it excludes, so this is what we talked about in closed session at the 2019 operating budget, exclude the proposal listed in confidential attachment 3 to the report. So this is this one.
Okay. As long as you know what we're doing, I'm happy. Number 3, put in number 3 and 4, basically give meaning to what we did in camera, okay? And the clerk knows what we're doing, and whatever I'm gonna suggest that we trust her. All in favor of those motions carried. So does that take care of everything in the?
And we have to do adopt as amended.
Adopt as amended. All the recommendations that formalizes our budget submission as a board, which is slightly different than the medical officers of health, but it incarnates what we've all decided in camera and outside of camera. All in favor as amended of the Board of Health operating budget for 2019. Opposed if any, that's carried. We have a similar one for the capital budget and budget request. It's item 29.5. All in favor of that. Opposed if any, that's carried. Next one is 29.06. This is around the student nutrition program, independent school update. You have a motion there. And basically, the amendment is that oh, yes, okay.
So that's the one from Board of Health.
From Board of Health budget, yes.
Yeah, so we have to bring
All
that
in
forward.
favor of that? Opposed, if any, that's carried.
And then we have another one.
And then you have another one related to student nutrition. And that's allowing it to go public, and it'll be stopped if there's anything that doesn't happen that's not appropriate after the 2019 budget in 2019. All in favor? Opposed, if any, that's carried. We have one more item. That's Councillor Cressy's motions related to consumption and treatment service guidelines and locations in the City of Toronto. I hope people have had a chance to read it. Do you want to move it? Yes, okay. Paul Nagpal. All in favor? Opposed, if any? That is carried. You can go, brother.
Okay. No, I can you stay for a minute? So I know this is a little out of keeping with the procedural rules, but I'm going to have to beg your indulgence for a brief moment, Mr. Chair. So folks, this afternoon, right, I'd like to just take a few minutes today to acknowledge and thank Councillor Mackovic for his leadership over the years as the chair of the Board of Health. And I'm going to call your attention to the screen because there's some visual.
Do not show my staff that picture, that shirt. Okay.
Okay, Councillor Mackovic, I'm sorry, Mr. Chair, I have the mic now.
Okay.
I'm trying to thank you for your leadership over the years as the chair of the Board of Health and supporting the work that we do each and every day to make Toronto a healthier city for all. This is your last meeting as chair of the Board of Health, and we did want to take a few moments to acknowledge your significant contributions. To the audience, Councillor Mackovic has been serving the people of Toronto as an elected official since 1991. As a councillor, his areas of focus have included public health, poverty reduction, and the TTC, just to name a few. And his leadership has been instrumental in driving action on these files and countless others at the local level. In public health, some areas that Councillor Mackovic has championed include his work towards restricting tobacco use in the city and his advocacy towards opening the first supervised injection services in our city as well. The tobacco restrictions at the municipal level and the restrictions championed at the provincial level have literally transformed how we manage smoking in our city. Councillor Mackovic was at the forefront. He was one of the first to recognize that there was a genuine opportunity to reduce smoking rates, to limit the health harms associated with secondhand smoke, and to improve, ultimately, the health of the population. As I alluded to in some earlier comments at this meeting, let's not forget that when bylaws were first introduced that restricted smoking, when provincial legislation changed, there was tremendous resistance about the impact that this would have on tourism and the hospitality industries. Hence what I characterized as vigorous discussion and lively debate. I think it's clear that Councillor Mackovic saw the long game on this issue and the difference that health policies and bylaws could make to improve the health of all the residents of our city. Thanks to your leadership, Councillor Mackovic, we now have a decline in smoking rates. We have safer workplaces for those who are employed in the service industry, and reduced health impacts associated with secondhand smoke. And as it turns out, we also have thriving restaurants, patios, and public spaces that are all that much more enjoyable without cigarette smoke. And we are a better city for it. The second example I wanted to highlight is Councillor Mackovic's commitment to harm reduction and the opening of the first supervised injection services right here in our city. In my all too brief time working with Councillor Mackovic, I've become keenly aware of his sense of justice, his commitment to do more to address health inequities, and his approach to engage colleagues and the people of Toronto in a meaningful conversation about what can be done. Finally, I would be remiss if I didn't acknowledge Councillor Mackovic's political leadership on student nutrition. His tireless commitment to this program and the children of Toronto has resulted in over 200,000 school children receiving over 37 million meals every single year. What an incredible legacy. So I know that there are others here who want to have their moment to say something, so I will keep my remarks short. In closing, Joe, Mr. Chair, Councillor Mackovic, it has been a true honor and a real privilege for me to work with you. And I know that I speak for myself, for my Toronto Public Health and Toronto Public Service colleagues, and for all the residents of this city when I say thank you, thank you, thank you for your commitment, your leadership, everything you've done to make this city a healthier place to be. So. So for all who are a little further away, just a little memento and a little reminder of all your remarkable contributions, accomplishments, all the things you've done.
Look at that. This is good stuff here.
We hope that, you know, when you look at this, you'll smile and think of us and continue to champion public health as you have done for so many years.
Thank you. Do I get a retort? Can I say some things? Is that okay?
I think there are some others who want to speak first, if I remember correct. If I've got this correct.
This is kind of your show.
Yes. You're going to have to let me go with this one for now. We'll let you get back in the driver's seat very shortly. So I'm going to put this here. So over to you, Dr. McEwen.
Mr. Chair, you know better than most that public health professionals can come up with any number of innovative ideas for programs and policies to make the city a healthier place. But frequently, actually getting those things implemented requires a kind of strength in political leadership and a skill in building consensus, which is increasingly rare. So I think you should be extremely proud of the legacy that you leave, because that's the area, that transition from ideas to action is, I think, where you've made some of your biggest contributions to the health of this city. As a chair and as a member of the Board of Health for many years, you leave this city healthier than you found it, and you should be very proud of that. Personally, I just want to say what a pleasure it was working with you when I was Medical Officer of Health. Your sense of humor, your thoughtfulness, and your compassion made our working relationship a real joy and made my life a lot easier. So thank you very much for all you've done.
So I think it's open mic time. No, everybody, we'll let you have your retort.
Well, let me just say this about that. You know, I've kind of been thinking about public health, and yes, this is my last meeting as a chair and as member of the board. You know, since amalgamation, there have been two chairs of the public health. There's been myself and John Fillion, and we've gone back and forth. And there have been three medical officers of health, two of which are in this room. Of course, Eileen Davila, David McEwen, and Sheila Bazar, who started as the medical officer of health for the City of Toronto, and of course has passed away. And you know, I sometimes say to folks, sometimes folks ask me, like, what are you? Because I've been around this place for over 25 years. What is your most proudest achievement? And people, I think, expect me to say the Witchwood Barns or the St. Clair Streetcar project. And you know what it actually is? It's actually the Smoking Bylaw that I was part of with many of you here, Carol Timmings, Dr. McEwen, Sheila, so many of us in this room, where we took it in the chin. We took it in the chin in 1995 when we tried, first and foremost, I was there with the current medical officer of health of Peterborough, when we were doing it in the city of York, while you were doing it in the city of Toronto, while the doctor in North York was also doing it, and the Restaurant Association pushed back real hard, and they won. And we had to do it again in the year 2000, and that time is when we finally won. In today's report from the Medical Officer of Health on the budget, you will notice that smoking rates in Toronto have gone down from the mid-20s down to something like 12% in this period of time. That much. And you know what? No one knows about it, but I can imagine that there are, what, 200, 300,000 people out there in Toronto who don't smoke because we broke that link between smoking, having a beer, being with your buddies. We broke that link. And they're leading healthier lives, and you can see the numbers in terms of longevity of people living has increased. There's Michael Purley there, who was part of those fights for the last 20 years. That, to me, is an accomplishment that is so transformative, and yet it is just a quiet mitzvah that is out there in our community. When I think of the work we did with SARS, Sheila and SARS, like, she really gave her life to that issue. Of course, the student nutrition program, the restaurant grading system. We are top of the class in Canada for restaurants right now. And how often do you hear or see in the newspapers that someone has had food poisoning? Not very often. And that's because that red, yellow, green thing that we put in those windows, boy, did it get people to clean up their act. The casino debate, the healthy city by design, the poverty reduction in the housing, yes, kind of verging into other departments' territories, but doing it from a public health perspective, like, holy smoke, that is good work. Sometimes I say that you can change the world if you really pay attention to public health. You know, it has been a real privilege to work with you, Dr. Davila, David. I hope we can still count on you for the Trivia Pursuit games at the Witchwood Barns in support of Witchwood Open Doors. And folks here, Carol, Jen, really all of you, sorry, I'm not going to mention everyone. I also want to, if I can, do a shout out to my staff. So Skylar, Maharaj, and Michelle, and Beth, and Milana, who is focused on the food issues. Like, public health is just so important. And I am really going to miss you folks. And I just want you to know that you are in my thoughts, in my prayers, and in my good wishes to continue the good work that you're doing. And I see the mayor's here.
Sorry, Mr. Chair.
So thank you very much, everyone. It's been a great 27-year run, and I am full of gratitude for the good work that we have done together. Thank you.
So, yes, if I may.
So, Mr. Chair, I'm going to steal the chair for now. And I believe we have a new guest in our boardroom. So, Mr. Mayor, did you come for any particular reason? Anything on the agenda of interest?
I'm used to control microphone. I only sit up there normally. Mr. Chair and members of the committee and ladies and gentlemen, you know, when you hear 27 years of service mentioned, it hardly seems adequate to come and say the words that we've said. And I knew that you were presenting a compendium of some of the stories that Joe Mackovic worked on as chair of the board and otherwise, and as a member of the Board of Health. And what we end up giving, I do as mayor a lot of the time, also seems completely inadequate when it's measured against 27 years of public service. But I think you'll know from the election, and I hate to raise that because it will be a sore point with some, how highly I think of Joe. I just believe we didn't always agree in the short time that I've been here, but I knew that you could always work with him. I knew that his point of view was always put forward in the most sincere way, you know, backed up by usually a lot of sort of information and evidence that he'd gathered, but certainly never with anything other than the most sincere conviction about the people that he was trying to help, because it was always about helping people. And, you know, frankly, I knew of the student nutrition programs, of course, when I came into this building. There were a lot of things I didn't know much about when I came in as mayor, because I hadn't sat here before. And in my first budget that we had to put together, which was following an election, of course, I think Joe was in my office about every 15 minutes seeking additional support for the student nutrition program. But because and frankly, I hadn't been to see it, you know, to actually go to visit it in the schools until after that. But he alone convinced me that it was something that should be included in the budget at an increased level. And then once I'd gone to see it and it formed part of the poverty reduction program, it got increases thereafter, perhaps not in the eyes of the members of the Board of Health enough, but it certainly got significant increases to the point where I think we've almost doubled it. And that is, among other examples, largely thanks to the advocacy and the passion of Joe Mackovic. And when Pam McConnell tragically passed away, it was relatively easy for me actually to conclude who would be the most appropriate person to be the poverty reduction advocate, because I'd seen in the work that he'd done in this area that he understood and was able to help educate me with respect to the socioeconomic determinants of health and how these two things were very much related, and how that meant that we had to address as best we could the challenge of reducing poverty in the city. And so, Joe, as I say, you come in here with one of these things, and I guess I can only say to you, if it makes you feel any better, nobody else gets anything more. It's like when you work for the United Way, at the end of your service, no matter how long it is, in my own case, I think it's about 20 years, you get a T-shirt and a mug, and that's it. No, but that's what everybody gets, so at least you don't feel you're being shortchanged. But Joe, I hope you understand. Pardon me? Well, I'll give you that too. That's not a problem. Very few people ask for those, actually, so it's good. I feel better about that. What it says here is simply the following. And again, it's a simple, it says, Mayor John Tory would like to extend a heartfelt thank you to Joe Mackovic for service as a member of the Toronto City Council, and in particular for your leadership as Chair of the Board of Health. The Board of Health, through the work of Toronto Public Health, strives to reduce health inequalities and improve the health of the whole population. Your leadership as Chair and your role as the city's poverty reduction advocate has ensured that Toronto is a healthier city for all. Thank you for being a thoughtful leader, a dedicated elected official, and a true public health champion. And I hope that in a small way conveys the gratitude that I certainly feel, and I know the other members of Council do, for all these years of totally distinguished, reputable service, and it just comes with a lot of affection and respect from me. I will hobble up to give it to you personally and the hug.
Thank you. You know, he forgot one thing where we worked together very well, along with Councillor Cressy, and that was around the supervised injection sites. When we as a City of Toronto, getting your head around harm reduction, really it's complex intellectually, it's also complex ethically when you think of what you're actually facilitating and helping people do. And it was a struggle for me, and I know it was a struggle for the mayor as well. And one of the things that actually, Mr. Mayor, you charmed me when I heard that you went down to the site at Moss Park, and you stayed in the tent. And that to me said that you were willing to kind of work with the evidence and just figure it out. And I think if we use that as a city more, just stay in the tent and figure it out, we're gonna be an even greater city. So I'm really appreciative of my relationship with you and the relationship that we built through public health, and we did some good things together. Thank you, Mr. Mayor.
Any other questions? Anyone else want to speak? No? Motion. Thank you, Councillor. Motion to adjourn. Oh, hang on, we do have one more speaker. There we go.
Joe, this is a very sad day, but on reflecting back on the many moments we worked together and cooperated, and I'm really delighted that you felt the major achievement was the smoking bylaw. And I remember one meeting of council where, for the first time in any councillor's memory at the time, proceedings had to be suspended because the restaurant and bar people were so disruptive. It was really quite a hallmark of that campaign. But I just wanted to say that over the years, we've interfaced on a lot of different tobacco issues, several, most recently the chewing tobacco in Rogers Centre, which we still have to get done. And all I can say is whenever we came together, whenever I approached you for anything, you always said, what's the issue? How can I help? What do you need? And those were the three things that always I recall working with you. There was never any calculation. There was never any consideration other than what's the public health benefit here and how can we get this done? So I just want to add my comments to the mayors and to Dr. Davila and everyone else, David's, who are either speaking about their time with you or reflecting back on it. Thank you so much for everything.
So I just want to add that it's been an absolute pleasure serving with Joe and with all the citizens on this board. This board wouldn't be the same, in fact, if it didn't have citizens. There's very few boards which actually meet here at City Hall with citizens. And we also have to thank everyone who comes out and does deputations. People take time out of their busy schedules to come and educate us. I know Joe will agree, we have sat here and heard some horrendous, moving, emotional, heartfelt stories about people's lives in this city. And I believe that this board has done its best to improve those lives, and there's still a lot of work to do. And I think that as an outgoing councillor, I am recommending out there on Twitter and Facebook that citizens sign up for these kind of boards, because we can do so much. We have done a lot, but there is definitely still work to do. So Joe, I'm staying in touch with you. We're going to go out and have fun. We're going to make sure the whole city gets chickens in the next 3 years. There you go, one of the things we did, not maybe at this committee, but we'll make sure the whole city gets that food important side with chickens. And thank you very much for being a wonderful chair and for making these meetings go so smoothly.
Thank you for being the vice chair and for all the good work. You had my back, and you had all our back over the past several years, and you deserve a great accolade for that work. Thank you. Okay, let's give her a round of applause. Yes.
Okay, motion to adjourn. Again, thank you.